Botox and fillers for the most part are used to make someone look more youthful. When I think about Botox, I think about softening the dynamic movement in the upper face. So if someone comes in and they say something like, people always tell me that I'm angry, or I'm noticing that I'm having more lines around my eyes when I smile, that's when I think about softening their expression with Botox. I think one of the biggest concerns that we hear is that I want to look natural, and I feel like if I have something done that I'm not going to look like myself. What I tell patients is we're making slight modifications in the way that you look, and we're making you look more like what you did a few years prior or more rested. When I think about filler, I usually think the lower face. And what filler is, it's a substance that can be placed beneath the skin to add fullness or volume, so that way you can take out the skin's natural imperfections, whether it be acne scars, or even just add back a fullness that was there years prior in areas like wrinkles. With Botox, I would tell you that I treat you today, you won't even see an effect from what we do for 48 hours minimum. Most people don't take full effect until they get to 3 to 7 days after. When I'll tease with patients and say the biggest risk with Botox is that you're gonna love it and you're gonna figure out a way to maintain it every 3 to 4 months, working it into your budget. It's something that it makes you feel better about yourself. You look in the mirror and see that you're just having a better day. It makes you a lot less critical of your physical appearance, but it's nothing that anybody else would notice. In terms of how it feels with injection, it's a very fine needle, and even comparing it to a bee sting is overkill. It's really something that there's more worry than what really needs to be with the injection. It's honestly done in 5 to 10 minutes maximum here in the office. I think the biggest concern that people have with Botox is looking natural. When you hear news taglines about concerns with Botox, there's Botox cosmetic and then there's also Botox therapeutic. And the doses that we use in a cosmetic situation are much lower. The risks really are very minor. It's bruising because we inject with a needle. It's potentially a need to camouflage a light bruise with makeup, but there's really no significant risk that I would really strongly caution someone about. Another great question that patients want to know is how long will it last? The average patient tends to get 3 to 4 months duration from each treatment, so I normally will tell you that it's a 3 to 4 times per year service. The great thing is that if someone has it done and they don't have a way to maintain it in their budget, it's not that once they start, they have to continue with it. If they have it in their budget now, they might even, have to wait 6 to 7 months to have it done again, but it still is providing a softening or a natural change to their appearance that doesn't have to be done right at 3 to 4 months in the dot. I think most patients consider Botox very affordable. The price is based on the number of units that we inject in the areas that we treat, but on average, I would say it's roughly $200 per treatment. In terms of what products we use only FDA-approved substances. The names that most patients would recognize would be things like Restylane, Radius, Juvederm, Bellatero is another one. A lot of the makers of these products will tell us that you can get a duration up to 18 months of effect. Our approach is to layer that product to treat additionally before it's altogether gone. We don't want to see these peaks and valleys in terms of facial fullness. We would rather just correct and then maintain that level of correction. I would say on average patients will get 6 to 9 months out of fillers, some as long as 1 year, but there are some, when put around the mouth, they may only last for 3 to 4 months. Downtime with filler really is dependent on the risk of bruising. If you come off of things like aspirin, ibuprofen, vitamin E, fish oil, 2 weeks prior to or even 1 week prior to, the risk of bruising is very minimal. In the event that it does happen, you can typically camouflage it and go about daily activities right away. If someone had an important event coming up, like a wedding or they were speaking at a conference, I would tell them to be safe to schedule their filler appointment 2 weeks prior to the important date. I would suggest that anyone interested in either neurotoxin services, which would be Botox, Xeomin, or Dysport, or even injectable filler treatments, come in for a free consultation. We really like educating patients, and so we feel like the more educated you are, the more successful we're going to be in terms of getting you to your end result.